Health. And we're extremely happy to welcome her back on stage with the panelists. Thank you so much. Let's give her a warm welcome.
Okay, well, thank you for having me here again, one more time. Well, this is going to be fun. We have three amazing guys. We're going to share, I think it's 25 minutes approx. We'll leave some time later for Q&A. So I'll ask you guys to start telling and sharing with the audience what do you do, basically, and what kind of problem is your company solving. So please, Pablo, you can introduce yourself well, the name of your company.
Well, thank you for the invitation, Mar. Happy to be here in my home country. My name is Pablo Pantaleoni, co-founder and CEO at MedTap. And what we do is we are a care plan builder platform where any physician can develop their own treatment plans and then prescribe as a digital therapy to any patient. And we focus in chronic diseases, rare diseases, and also post-surgery treatments. The company is based in San Francisco, California, and we have also offices here in Spain, in Barcelona, and then in Mexico City as well. And well, in terms of metrics, over 130,000 users working with big pharmaceutical companies and insurance companies in Europe, US, and Latin America.
Thank you. Please, Christian.
Thank you, Mar, for having me. I'm Christian, COO of Universal Diagnostics. 40%, as we're here, of all of us, will develop cancer in their lives. We don't know who, we don't know when, and we don't know where. Sort of breast, lung, wherever. But what we do know is 90% of that's curable if detected early. And that's where Universal starts. We develop a blood-based cancer test to detect cancer early, or ideally pre-cancer stages. First module is colorectal cancer, which is deadly if detected late. It's really unpleasant as the clinical workflow looks like right now, and the incident rate is really high. We think we can do it with a simple blood test, which would be I think, market-changing innovation. We're finalizing R&D, entering clinical validation now, and are hopeful to get this done into the market until the end of next year.
Thank you. Please.
All right, Mar. I'm Ignacio Vivas. I'm the CEO of Oncovision. It's great to be next to Christian because I can phagocyte what he's actually doing. Oncovision does molecular imaging. We are able to see tumors as small as 1.6 millimeters in breast. We also can see nodules inside the body during the surgery, so actually positive nodules, which is one of the problems after they remove the tumors, because obviously that's what's going to allow the tumor to spread afterwards. So having a test that can actually tell you that you've got a tumor and having my image, that's a business opportunity.
The treatment.
Yeah. And then we've got the treatment.
Maybe we should line up in a different way here.
I was invited to this. Here. No, but the good thing is, obviously as a company, the company is, technology company. The next big thing that we're getting into is, I guess, the disease of the future, which is dementia and Alzheimer. I think, Obama recently, he mentioned that, they recognize that is, a key element. People are going to live longer. We heard your presentation, Mar. But we also need to understand that there is going to be a degeneration of the cells, and the important thing is how early can I detect that in order to fix it. So.
Thank you so much. That was a great intro. Now we all can have a broader view of what are you guys doing. But if we have to go a little deeper or specific, how is your company improving patients' life?
Well, in our case, it's really to help the patients understand their treatment. So usually when you go to your doctor and then they prescribe you, okay, you have to take these drugs, and then, this specific diet, and most important, if you have these side effects, let's say diarrhea, fever, then for 3 days change to or add this medication, well, it's kind of confusing. And there is a lot of information that it's getting lost on the process. So it's all about with our platform, the patient can really understand the follow-up process and really important, learn and improve their quality of life. And it's all about, change behavior. So lasting behavioral changes, that's what we try to achieve thanks to our platform. And I always say that what I'm most proud about is to read the hundreds of testimonies that we got, and specifically, you talk about mental health. So I remember like a month ago, we have a very interesting one for borderline personality disorder, and to read about, I was thinking on the suicide, but thanks to the treatment using your platform, I kind of, think about it and didn't do it. So this is what we try to achieve.
That's a good example. Thank you.
Yeah, how to be simplified. Who is taking a colonoscopy out of us here? Anyone in the room? Oh, we're way too young still, so that's good news. But we will switch from colonoscopies to blood tests, and that's a huge alleviation for patients. Second, we detect for colorectal cancer also the pre-cancer stage, adenomas. So in that way, we're not able to detect cancer, but to prevent it. That's a huge change to what is in the market right now. And the third thing, but that is further ahead, is bringing our test onto devices that can be used at room temperature. That you can take in your living room, sitting on the sofa, take a drop of blood, send us the test by a normal mail, and we analyze it in our lab, which would be a huge, simplification in the process and making it much easier for a patient because you can actually avoid going to the doctor.
Thank you. Nancy, please.
So the way we improve patients' life, and I'll just focus in breast cancer. We've got a device where the breast is not compressed, where we can see every tumor because we see a functional images. We don't see a static image. We don't compress like they do a mammography. We don't stretch the breast like they do in a mammography. And most importantly, and that's something that a lot of people don't know, women under 50, they have dense breast. Mammographies miss 75% of the tumors. So just imagine you use Google Maps and you put an address where you want to go and it misses 75% of the times where you want to go. You would not do that test. No. So unfortunately, obviously it's a new technology. We have to go through all the protocols, to get it established. But it is, from a patient perspective, giving you the comfort that, actually what we're seeing is what is there, that we are not harming you every time that you go and get that yearly check. I think that's, invaluable. It's actually, when we get the test from patients on patient satisfaction, we usually get a 10 out of 10 or, sometimes even 11 out of 10 if that were to be possible on the comfort that it gives them and the security that it gives them to actually, when I tell them that there is actually a tumor, there is actually a tumor. Your number of false positives and false negatives is significantly reduced.
Got it. So you were talking about, patient satisfaction, some reviews about people using your apps, your products, your company. That must be very meaningful for you guys, especially during the hard moments, right? So talking about that, could you share with us what was the biggest challenge that you have to face when you were funding, when you were every day leading your company, or just pick one and talk about it? It's good to talk about the bad things as well.
Yeah,
right?
for sure,
That's how we learn. Okay.
Yeah.
Well, in our case was when we decided to move the company to California. It was not easy in terms of all the legal, regulatory. It's very different here in Spain than in the US. And then for sure, when we scale it after an investment round, and to lead both sides of the team, different cultures, and how to scale the business, and then starting with new customers in the US. Again, the market is completely different, more mature, and more players into it. You have to learn really quickly, and that was a huge challenge. So, but very interesting one.
Where do you find the strength to keep going when you see this change of, culture or,
I think it's key because it's completely different. I mean, you have to really understand the market that you want to approach. And in case of, and you know it very good for sure, the health market in the US, it's more mature. There are more challenges, especially with all the Obamacare and more players into it. And then the FDA changing the rules from time to time. So you have to be aware of all this and what are the major players, who is the payer, who is the provider. For example, pharma companies, which is our main customer, plays a completely different role in the US than in Europe. So, I mean, it's, if you learn how it works, it's also a competitive advantage. And also on the other side, so the opposite, if companies from the US think about, going abroad and either European market or Latin America, well, they have also to learn about it because it's completely different.
So it's kind of a relearning.
Yes, yes, that's how it is.
Got it. Christian, please.
Yeah, I would probably look at our fundraising. And over the last 4 years, we've raised 3 rounds, mainly with local biotech investors, funding programs, and business angels. And now we want to take the next step and close a round with institutional investors. And sometimes it feels a little bit like the chicken and the egg problem in terms of the amount we want to raise, the clinical validation we have to have for that amount.
That's key.
Versus the ability to get that clinical level validation with only limited amounts of funding. So that's really tricky. And hopefully we get to an end of that process now. But bridging clinically valid data and limited amount of funding in our area where statistically relevant analysis has to be done with a lot of samples, it's challenging.
Thank you.
Well, my situation is a little bit different because obviously I came into established company that actually had spread itself very thin. So it was more about reorganizing the company and trying to focus into the markets. And then obviously, putting your plans on how to grow the company. That also has, its challenge because you also need the funding in order for you, to reach those milestones. So far, what we've done, and that's something that we recently did, is we spun off part of the company just to stay ourselves focused. I think companies that have a technology background, one of the risks that they have is that they can spread very thin, and at some point they forget what's their aim and what should they focus and what should they not focus. So obviously that's been a little bit different from them too.
Thank you. Interesting. Very different answers. So what do you think it will be the most disruptive measure to hack the healthcare ecosystem? Actually, that's the name of the panel, right? So go ahead.
Well, for me, there are 2 things. One for sure in terms of regulatory. So again, what we've seen in the US, and the reason because 80% of the digital health market is in the US, it's thanks to the Obamacare and where big incentives to bring all the information to the cloud. And second, for me, it's really important in terms of connecting different systems. So as you know, there are thousands different systems, and you have to make it really easy to the healthcare professionals in terms of the flow. So, I mean, I've seen a couple of very interesting companies now approaching this problem and really focus on integrations on both sides, on the healthcare professional side and also on the patient side with wellness apps and devices. And I think this is key. Yeah.
Thank you.
Yeah, I agree. Really good points. Let me add one more. I think we will move more and more into a more output-based system. What do I mean with that? Look at the discussion that we face in diagnostics. Everyone knows preventing cancer saves lives and saves huge amounts of money. But we haven't really made that transition to get into that perspective. What on a population scale makes sense to fund in terms of reimbursement and what doesn't? And that's where later on the innovation will go. So I think that the more we get into output-based systems in measuring what is effective, what is not effective, what helps, what doesn't help, that will drive massive innovation and huge changes across the field.
Agree.
Oops, sorry. Thank you. Oops.
Oi.
Oops.
We want to make
Any
the
doctor in the room?
We could have
make the
hacked
panel
the
very
healthcare system right there.
Thanks. Ignacio, please go
So,
ahead.
I mean, I think two things. Short term, I mean, I agree with Pablo. I mean, I think, the regulatory pathway. I mean, he talked about the U.S. The U.S., it's not complex when you start going to Asia. Let's not forget that the second medical device market in the world is Japan. China is getting, to become the third largest, in front of Germany. So, they have a very complex protective systems that they obviously enhance for local companies and try to avoid, external companies to get into those markets. I think as we move into the future, it's going to be education. And the reason why I say education is, you guys are talking a lot about data. How do we get that data down to the public? My only fear, and someone alluded this afternoon about it, is the medical world, the physicians, a lot of times, by the time they prescribe, they're in the mid-40s, and by the time that they're chiefs of departments, they're in the mid-50s. And a lot of that information, they kind of see it as a threat to what they've currently been doing. In the past 10 years, we've moved from surgery to minimally invasive surgery. Now we're going into microsurgery, so peripheral surgery. I mean, we're going into something that is really, really minimal, and that also requires that, we're able to educate. We've seen companies like Intuitive Surgical. We know that the younger generations do a lot better, younger physicians do a lot better with a robot than older generations, just because, they grew up with video games, they grew up with a lot of, 3D stuff, so they're a lot more used. So I think, as we move into the future, I think the education and how do we make sure that gap, that is probably about 15, 20 years, we're able to cover it.
Right. So we're doing great with time. This is basically the last question before another little thing I have prepared, and then and then the Q&A with the audience. But so, from the three of you, who thinks that emerging markets are going to lead the digital health revolution? Yes or no?
Yes.
Christian?
No.
No.
Okay.
Well, you said I have to say yes, huh?
Yeah.
I'm kidding,
I didn't say anything.
No,
The only thing I said is I want to see some fighting
No, for
here
sure,
and
for
some
sure.
blood so to make it more
well,
exciting. So.
it depends on. I mean, again, we know very good the Mexican market, and because there are not so many systems into the market, you don't have to focus as much on wasting the time with integrations, and it's really easy to test something and then to scale it. Because, again, one of the big challenges of the healthcare system, it's the different integrations with the system. So what I've seen a lot here in Europe and in the US, great systems, they start pilots, awesome results, and then, okay, let's scale this. And this is a huge problem. So I think where you can test it really quickly, for sure, other markets are more mature, in terms of resources, in terms of, it's like a trade-off. So if you take advantage of what you have, I think maybe they can potentially lead this.
Yeah,
You said no.
I said no, and I completely disagree.
Good.
No, because in the end, I think, at least from the field that I see around us, is the major innovation comes still from the institutions, the universities, the academics in Europe and the US. That's where the knowledge is created. Yes, developing markets are catching up, and a lot of development there. But still, the real deep innovations in our field, at least, come from the western side of the planet.
But we're talking about innovation or to really scale and make a difference. I think there are two different things. So innovation, I totally agree with you, because again, you need like resources, and you have more in the US and Europe. But then again, how do you scale this?
Yeah, scaling. I mean, if you look at from our perspective, as you said, it's not easy to do that outside of Europe. Starting with the fact that if we want to go into China, we need to prove our test works on Chinese samples, and you're not even allowed to export them. So it's complicated, and yeah, agree.
Well, I mean, I said no, and I guess that when we talk about emerging markets, I mean, I guess that we need to differentiate emerging markets. I mean, you just mentioned China. There is another thing that you need to caveat that you need to throw out there, that is, the ethics in certain markets. I mean, that's why a lot of times we do test outside of Europe and the US, because the laws are more forgiving, and it allows us to do certain things that they're more restricted. So from that perspective, if I were to look at China, I know that there is a lot of biotech being done faster than what we can do it here. And so I would just say, from emerging, I would say like China can be. I think you were alluding to Mexico. I think you're going to find pockets in certain of those markets. How can you scale it? That's why I said no. And I think that obviously, in the Western world or the more developed countries, you have then the base to scale it, just because the level of education of everyone is
more
there, and all this.
laws, more regulation, more systems.
But still, a lot of those barriers are going to be broken. I think the way we know healthcare today, it has to change. I mean, as people get older, we live more years. I mean, we want our pensions. That's not sustainable.
So you think, Ignacy, sorry to interrupt you, but that is not a question of if it's going to be broken or not, these kind of barriers that you're mentioning? It's a question of when? Is that what you're saying?
Yeah. Yeah. I mean, it's
has to happen.
It has to happen.
Yes.
I mean, if we leave, one of the, I think maybe it was about your slide today. I mean, in 100 years ago, people, the average, they live 45 years.
Yeah.
Now we are close to 80 on average. I mean, in Russia, men die at 62. But if you
in Africa, it's below 50.
Yeah, but I mean, but if you look at the developed world, where you have pensions and where you have Social Security and all that stuff, I mean, it's not sustainable if we go past the 80s. And that's something. I mean, actually, I saw that in one of the European countries, where they had a few years ago. They showed me a government graph, where they had the cost of healthcare. And you could see that there is a slight bump when there is a baby, or when there is a boy or a small child, and then it's pretty much flat. And then at 40s it goes a little bit up, but then at 70s it just skyrockets. So that skyrocket, I mean, at some point you won't be able to keep it. So what we're seeing in countries like the UK, I mean, you're being penalized actually if you had bad behaviors like smoking, or you don't have. You don't do sports or anything like that. I mean, you'll get a letter from the NHS saying, you're obese and you need to lose weight. So, because someone has to pay that bill.
Sure. Anything else to add to this discussion? Or can I just ask the last thing? It's not a question itself. It's more, if you have to share a sentence, one thought about all your career so far, all your experience, if you want to share that with the audience, you have the opportunity to do it now. So
you can start if you want. Well, my sentence will be add value. If you don't add value into the flow of the healthcare systems, then for sure you're not going to succeed. So there are many different, but I've seen many companies going into the space, and especially, other entrepreneurs that they don't understand really good the healthcare system. And if you don't make it easy for physicians, patients also, but really add value, save time, save cost, focus on outcomes, then of course you cannot go, you cannot scale and succeed on this.
Christian?
Okay. Yeah, I would say just do it. just get started. Any idea you have that improves time, costs, whatever it is, just get started. Get out there, test it, validate it, and develop it. It's about doing. It's about proactively going out and doing it every day. That's what we try to do at Universal. Just do it. Just experience, trial, error, but just make sure you do it and you don't only talk about it.
Thank you.
I think in order to avoid frustration, I think one of the things you should do is try to understand the healthcare market. You know, whether you want to focus in one market.
Is that possible?
Somewhat.
I think you can read it.
Actually,
too,
you
right?
come from consulting. You took a lot of money from the companies telling us
Now
how
it's
to
getting
do it.
personal, huh?
that was a good one.
So I'm like, that's one thing I learned from you guys. So no, but you know, I mean, try to understand, you know, and try then to find the sweet spot for you. I've seen a lot of companies where they want to go after all, and I think it's a lot easier to go and focus and you know, try to enter. Let's not forget, I mean, what I was saying before. I mean, by the time you're dealing with physicians, you're dealing with emotions. You know, we talk about big data. We talk about a lot of things that are very, very important. And one thing we don't talk about is the psychological aspect of patients. You know, I'm a pharmacist. I used to do, you know, pills that had nothing inside just so people would feel better. You know, the famous placebo. So, you know, that's still there and it will still be there. But I think it is, you know, again, I mean, try to understand what you're, you know, where you're entering. Try to make sure that once you understand it, you say, look, that's where I will add value. And that's what, you know, I agree with Pablo. And then go for it. You know, I mean, don't let people,
point,
you know, because it's kind of an interesting industry. I mean, it's a very, sometimes it fears change. You know, I mean, when the Vinci, you know, before I talked to the Vinci, but, you know, a lot of physicians is like, well, that's not going to work.
Oh,
you know, so you're going to hear it over and over from, you know, highly educated people.
Yeah.
So you need to make sure that you get a good partner next to you and you run at it, you know, as fast as you can.
Well, thank you so much. I think we have 3 minutes. If anybody has a question, please raise your hands. Okay, go ahead, please.
I would like to ask them the question that you asked in your session earlier. Who wants to be immortal among you three? Yes or no?
Thank you.
Oh, no.
You want to be mortal or not?
No, I don't want to be. No, yes, I want to be mortal.
You want to be
yeah,
mortal?
Yeah, yeah.
You want to be?
I want to die.
You want to die?
Yes, yes.
Okay,
yes.
clear.
Yeah, I want to die too. Not yet, but
Yeah, no, not yet. For sure not.
Like,
Ignacy, please.
so far, if I can, no. I mean,
Okay,
I want to
thank
leave.
you.
No, I mean,
Thank
you
you.
know, I want to leave. I mean, I'm like, you know, you guys go. I'll take care of the rest.
Not sure if we have time to go into detail of why you want to die and why you don't want to die, or do we
what about you, Mar? You want to die or not?
I mean, you know, taking in consideration that I just gave a talk about immortality,
You
I
have
should
to
say
say
yes. You know, I have to say yes. Depends on how. I guess the answer is depends on how. You know, in what condition,
Yeah.
right? So it's
We'll
not the
fix it. Don't worry about it.
We'll fix it.
They won't be here. So,
Yeah.
so, yeah, exactly.
Yeah.
I mean,
That's right.
Any other question? No? Nothing? Okay. Well, thank you so much,
Thank you.
and thank you guys. You were
Thank
great.
you, Mar.
Thank you.